to go ahead and get started with the introductions. My name is Amber Jones. I am the co-coordinator for the Southeast PTTC, and we're really glad you're here today for today's presentation. Today's presentation is Substance Misuse Among American Indians and Alaska Natives, presented by Dr. Bell. I'm going to start off by doing some brief housekeeping announcements, and then I'm going to hand it over to Dr. Bell. From our team, Angelica just introduced herself. We also have Chisholm, so we'll be here to support you in the chat, or if you have any tech issues, please reach out to one of us and we'll be happy to assist you. Before we get started, we have to start with our acknowledgement. I am not going to read this, but I just wanted to highlight that the opinions expressed herein are the view of the authors and do not reflect the official position of DHHS or SAMHSA or the Southeast PTTC. So if you're not familiar with the Southeast PTTC or the PTTC, we are a network of regional centers across the United States and a little beyond that support the substance use prevention workforce. We provide training in TA in the efforts to address substance misuse across our nation. So that's a little bit about us. And then there's 10 regional centers across the United States. And like I said, a little beyond. We're Region 4. We are housed at Wake Forest University School of Medicine in Winston-Salem, North Carolina. And we are led by co-directors, Drs. Wolfson and Wagner. So again, I'm going to talk a little bit about housekeeping, and the biggest question we often get asked, will you receive a certificate? Yes, you will receive a certificate. And the way to do so is to fill out a very brief evaluation form. Your feedback is really important to us. So even if you don't need the certificate, please take just a couple minutes to fill that out. We really appreciate that, and it gives us an opportunity to continue to offer these free trainings and webinars. And then also the recording will be available within a couple days. Please also know that we will be sharing the slide deck along with the recording. And then also, if you miss it at the conclusion of today's webinar, the evaluation link. We'll send a post-webinar email within a week. Typically, it's done within 48 hours, but please give us grace if it's not within those 48 hours after the conclusion of today's webinar that will contain all these materials as well. And without further ado, it is my honor to introduce Dr. Bell for today's webinar. I'm going to hand it over to you, Dr. Bell.
Thank you, Amber and Angelica, and thank you for the opportunity to speak as a part of this group today, and happy to be a part of this organization and this presentation today. So I'm going to share my screen here. Hopefully this will work again. Can you all see my slide? All right, so here's just kind of an overview of what we're going to cover today, and I'll leave plenty of time to ask questions at the end, but certainly feel free to put questions in the chat. They will be monitored as we go along, and I'll be happy to address those to the best of my ability. So first of all, I will, as a part of this presentation, sort of give an overview of American Indians nationally, and since I'm here in North Carolina, I focus a lot of the attention on our population here in North Carolina that we serve, and then talk about some of the work that's been done over the last 7 or 8 years looking at overdose disparities in this population of American Indians in North Carolina. Talk about some of the collaborations that have been going on, both focused on just health in general, but also looking specifically at addressing some of the substance use disparities in our population here. And I always get this question when I do presentations like this. You know, people will say, well, what's the most appropriate term? Is it American Indian? Is it Native American? Is it Indigenous? I think we sort of instinctively use these different terms interchangeably, but they're if you do the Venn diagram, they don't like totally overlap, but there is some overlap. And so, the term indigenous, people are using that more, but that's an international term. So, any people that can trace their lineage to a particular homeland over millennia, we typically refer to them as indigenous. So the Maori people in New Zealand are they are considered indigenous people. But people of Central and South America, they're indigenous, and so we do use that term now. But and then the term American Indian is more of a political term. That's who if you go to a federal agency and they uh, you know provide any data or documentation for this population, they will use the terminology American Indian or Alaska Native. Native Americans started to be used some in the 70s and 80s, just to differentiate from that history of the use of the term American Indian going back to colonization. But you'll oftentimes see that, particularly in the Southwest, people will use the term Native American. So I will use them interchangeably through this presentation, so I don't want to confuse you and make sure that you understand that the differences between the two. So when we refer to the population that is identified as American Indian or Alaska Native, it's not a relatively large populations, and I'll give a couple of caveats here that we talk about this population as a homogenous group of people, but they're really not. There are communities that have their own history, their own culture, their own where they are located. It has significance to who they are as people. And so, if you look at the 2020 census data, there were roughly about 4.5 million people who identified in the census as only American Indian. And I'll give more clarification on that in a minute, which is about 1.5% of the US population, or at that time. And you can see that there are concentrations of American Indian people, mostly, in the Northwest and the Southwest, and obviously in Alaska. And some of that is by, these are some tribal homelands, but also, thinking about particularly the peoples in Oklahoma who were forced there back in the 1800s when the federal government went through the federal removal process. And so as you look at maps like this, bear in mind those sort of perspectives on the history and culture of Native people. And also, the Navajo tribe, which is in that area there, the Four Corners area of Utah, Colorado, New Mexico, and Arizona. That is the largest American Indian tribe in the United States, and they have that concentrated area there in that region. And so, I mentioned that, when we think about American Indian people as that federal clarification or designation, if you look at a census form, we actually have the ability now, that's not always been the case, but we have the ability now to identify as more than one race. And so the number I gave you before, that 4.5 million, is only those people who on their census form identified just as in the third box there, American Indian or Alaska Native. But if you include those people who identify as some other race, then that number more than doubles. So close to 10 million people identify as American Indian alone, or at least one other race. The other thing that the census is doing now, which it hasn't done historically, is that it allows people to identify what tribe or people group they are a part of. And so you can not only, check the box for American Indian, but also write in. So I would write in, I am a member of the Lumbee tribe in the box under where the checkbox is for American Indian. And then it gets sort of further um, challenging to understand because there are certain designations of American Indian tribal groups or people groups. And so there are 500, this is outdated now as of December of 2025. There are 575 federally recognized tribes, meaning that these are sovereign nations. They have a government to government relationship with the US government. So Indian people who are part of a federally recognized tribe are they're like dual citizens. So myself, our tribe, the Lumbee tribe, on December 18th of last year became fully federally recognized. So I have a tribal card as a citizen of the Lumbee tribe, but I also have my federal documents, my real ID card, and so I can vote. I vote in our tribal elections, and I vote in our local, state, and federal elections. So that's something that's important to understand that people who are members of federally recognized tribes have this unique relationship with their own tribe and with the federal government, including that tribes that are federally recognized have access to resources through the Indian Health Service. By treaty, federally recognized tribes are eligible for either direct service from Indian Health Service, meaning that the Indian Health Service will come into their community and build out a healthcare system, or they can contract with the tribe to where the Indian Health Service provides the funds through its called a 638 compact. They provide the funds to the tribe, and they can then use those funds to build the system that they feel like is best for their community. And so there are 12 IHS service regions across the country. The Navajo area is that very concentrated area there in the Four Corners area, that because they are such a large tribe. But then if you look at the eastern United States, because there are so few federally recognized tribes, the Nashville area is the largest geographic area because it doesn't have very many, going back to the map I showed earlier, there aren't that many federally recognized tribes, and so they have to have a larger area. Now with our tribe, the Lumbee tribe, which is a relatively large tribe, we're about 65 to 70,000 enrolled members. They may have to think of a different strategy for how, first of all, how we receive care services to IHS, but then also how the IHS Nashville area will be structured. So this is a map of North Carolina that shows the tribes and urban Indian organizations in our state. So we have, and this is actually outdated as of last Friday. We have eight tribes in North Carolina, two of which are also federally recognized. So that's another designation that a tribe can have, this state to tribe relationship where a state acknowledges the sovereignty of a tribe. And so in our state, we have 8 tribes that are recognized by the state, and 2 of those 8 tribes, the Eastern Band Cherokee and the Lumbee, are also recognized by the federal government. The Eastern Band Cherokee are the descendants of the people who, the Cherokee people who were not forcefully removed through some of the federal Indian removal processes going back to the 1800s. We also have 4 urban Indian organizations in our 4 largest cities in Charlotte, Greensboro, Raleigh, and Fayetteville. And those are service organizations that many Native people left their tribal community to go to the larger cities for employment or educational opportunities. And so our State Commission on Indian Affairs helped develop these service organizations in these 4 cities to help provide services to tribal members in those areas. And so thinking about some of the health issues that impact American Indian people, again, using the caveat that this is a heterogeneous group that has different histories and living in different parts of the country and different cultural nuances. There are a number of efforts to try to provide a overall view of what the health of American Indian people looks like. And these are just a couple of examples. The Kaiser Family Foundation has done some really nice work to look at some key health indicators for American Indian Alaska Native people. The American Cancer Society did a report. So they do their annual report, their ACS Cancer Facts and Figures, and in 2023, the emphasis that year was on American Indian Alaska Native cancer. So they do a different emphasis area each year. 2023 was American Indian Alaska Native. There's also Indian Health Service does some reporting out of members of their service areas. Again, keeping in mind that IHS is only available to federally recognized tribes, so that would not include their data would not include people who are not members of a federally recognized tribe. Here in North Carolina, we're actually very fortunate because we do have a relatively large American Indian population here in North Carolina. We do have, if you count people who identify as American Indian and at least one other race, we have about 300,000 American Indians in our state, which is the largest population in the eastern United States. And these are just a couple of examples of reports that have been done. So the report on the left is the North Carolina Institute of Health Child Health Report Card that came out in 2025. And then we actually here in North Carolina, we still have a very active state Office of Minority Health and Health Disparities. I serve on the Minority Health Advisory Council, and they every 4 or 5 years will do a minority health report card. And so the last one that came out was from 2024. And so this has just it's a really nice resource that has about as much data as you can gather in one place on American Indian health in North Carolina. And so some of what I'm going to show you over the next few slides comes from that report. And so they start with providing an overall picture of some of the upstream effects of related to the social determinants of health. And so as we look at some of that data here in North Carolina, we know that compared to American Indians, compared to non-Hispanic whites, American Indians are 2 to 3 times more likely to live in poverty. They're 2 times more likely to be uninsured. Again, keeping in mind that Indian Health Service is only provided to federally recognized tribes, and up until just, we actually don't have. We're only 7 months into our federal recognition for the Lumbee tribe. So we don't have it'll probably be another 2.5 years before we get our Indian Health Service health system set up. So because of the majority of our American Indian population in North Carolina is not part of a federally recognized tribe, many of our tribal members, because of the high poverty rates in our population, don't have access to health insurance. Also see high rates of American Indians not pursuing advanced educational degrees. And then kind of as we look at sort of the life continuum, we know that compared to non-Hispanic whites, American Indians in North Carolina have about a 2 times higher infant mortality rate. We see some of the indicators that relate to poor child health outcomes are more prominent. So lower rates of breastfeeding, um, higher rates of being born to a teen mother, um, and I mean also even extending into young childhood to up to age 18, we still see that persistent disparity in child mortality. So Native children are 2 times more likely to die before adulthood compared to non-Hispanic whites. And as we sort of look into adulthood and seeing some of the disparities, particularly, and this is kind of a national phenomenon that American Indian people have high rates of being diagnosed and dying from diabetes and diabetes-related complications, high rates of cardiovascular disease. Interesting that the profile for cancer is kind of unique. We do see a lot of stomach cancer in our tribal populations. But we also, we do see high rates of lung cancer because we have exceptionally high rates of cigarette smoking in our populations. And then Native people are about 50% more likely to die from Alzheimer's disease compared to non-Hispanic whites. And then some other sort of public health indicators, we see high rates of communicable diseases, high rates of motor vehicular accidents, and the figure to the left that I show, that's from a paper that was published from our state injury and violence prevention branch, and they showed that not only do American Indians are they more likely to die as a result of being in a motor vehicular accident, but that the increase that occurred, this sort of unusual increase that occurred in deaths from motor vehicle accidents during the early years of the pandemic was actually much more prominent for American Indians compared to non-Hispanic whites. And we don't really understand why that was the case. And then, of course, COVID sort of highlighted some of these disparities that we see both nationally as well as here in North Carolina. So we know that many of the tribal communities that, the Navajo at one point had a higher rate of deaths from COVID than New York City. And it, a lot of that is driven by some of the living conditions that Native people live under, some of the working conditions that Native people were working in. And so we saw just sort of this devastating effect. Also the underlying health conditions where COVID, once you were diagnosed with COVID, that puts you at risk of death, hospitalization and death. And so thinking about sort of the context of our discussion today, looking at substance misuse and its impact that it's had in our country, and certainly thinking about what has happened, starting in at the early 2018, 2019, going up into 2021, we saw, this huge spike in deaths from overdose, and just setting off alarm bells and people trying to understand what was going on. And so, we certainly saw that here in North Carolina, particularly in the early stages of the COVID pandemic, we saw a very sharp increase in deaths from medications overall, but also drug overdose deaths, largely the result of disruptions in healthcare services and public health services and social services. So trying to understand, what was going on there and how the ways in which to address that was also important. But also seeing how the substances that were causing problems, the most problems, there was a kind of a shift where, we were seeing more drugs like heroin and fentanyl, particularly, where we just saw a massive increase in the number of deaths that were the result of particularly of those drugs. And again, thinking about the ways in which we can try to address those issues. But kind of more importantly, the at least the perception, the national perception, was that this was a condition, or an issue, a public health issue that was mostly affecting the white population, and in particular the young male white population. And so, we were seeing articles like this, where there was, the alarm bells were going off, and the concern was that this was the case because it was, at least the perception was that this was a condition that was primarily affecting the white population. But there has been more and more attention that's been given to how this issue has affected other populations, and in particular, the American and the Alaska Native population. And so this is a paper that was published in the Lancet in 2023, looking at what they call deaths of despair, and this is a situation where deaths of despair is described because of the some of the issues, the life challenges that people face. They are turning to suicide, um, violent behavior. So all of those factors that contribute to sort of living in a disparate situation. And so you can see here in the graph to the right, going back to the late 90s up until 2020, and seeing how there was this huge spike in the American Indian and Alaska Native population, and how this paper also talks about something I'll refer to later, the indigenous data genocide, meaning that oftentimes we don't give an issue like this enough credibility because of our inability to adequately describe what's happening in a population like the American Indian Alaska Native population. And so here in North Carolina, we're very fortunate to have, as a part of our injury violence prevention branch with the state health department, two epidemiologists, Mary Beth Cox and Scott Procheville, who approached me around 2018 and said to me that they knew of my work here in North Carolina, and sorry, I'm gonna take some water. So they knew of my work here in North Carolina, and had seen some troubling data on these increased numbers of deaths, hospitalizations related to substance misuse. And so we, with their incredible experience and their expertise, started looking at this issue a little bit more. And so one of the first analyses that they did was looking at, again, because our population is relatively small, oftentimes we have to sort of take a unique approach to looking at calculating like mortality rates or hospitalization rates. And so, they first thing they did is sort of looked at overdose death rates over, the first graph there on the left is over the 21 year period, and showing that of the major racial and ethnic groups in North Carolina, the American Indian population had the largest overdose death rate during that time period. And so you can see in the graph on the right, where looking at that trajectory starting around 2017, 2018, where we just see this incredible increase in the rates of death in this particular population. And so then, starting to look at, breaking it down by different population groups. Again, we sometimes will have a tendency to attribute overdose use to a predominantly young male population, and we see that compared to the total North Carolina population, higher rates in the female population, also, higher rates in that middle-aged adult population that was a little bit surprising compared to what we thought we might see. And then thinking about sort of the effects of like the use of injectable drugs, where you increase the risk of like hepatitis C and hepatitis B. And so we see that not as much for hepatitis B, but absolutely for hepatitis C, we see much higher rates in the American Indian population here in our state compared to other populations. Do I need to take a break and ask if there's any questions I need to address at this point? Have there been no questions in the chat?
There have not, actually, one just came up, and I think this is the individual that had their hand raised earlier. So the question is, an early slide showed 574 question mark federally recognized tribes.
Yep.
And Dr. Bell mentioned his tribe being recently added. What is the name and location of this tribe?
So it's the Lumbee tribe in southeastern North Carolina. So if I go back to the map I showed earlier, so the population in the light blue in the southeastern part of the state, Robinson, Scotland, Hoke, that is where our tribe is located. And so we are the 575th federally recognized tribe in North Carolina.
And I don't see any other questions.
Okay.
I did get you did get some encouragement. This is great information. I did get one more question. How is that spelled?
How is Lumbee spelled?
They didn't specify, but I'm assuming so.
Okay, it's Lumbee. Yeah, I see David Reed said yes. Yeah. Cool. Okay, good. All right. So I went back to Mary Beth and Scott just a couple weeks ago and said, hey, just want to follow up to see if there's any interesting new data, because I know nationally, we've seen a decline in deaths and hospitalizations from substance misuse. And I said, well, how is this looking in North Carolina, and how is it particularly looking for our American Indian population? And so they said, so they sent me these two slides, one showing that, from 2019 to 2023, we had this sort of across the board, high increase in the overdose deaths in all the major racial and ethnic populations in our state. And then, we from 2023 and 2024 is the most recent data they had at the time. So we've seen a reduction in all populations except the Asian population. And that's the incredibly consistent percentage reductions during that time. But also we still see in 2024 that the American Indian population still has the highest death rate in 2024 of all of this population. And what's interesting too is that even if we, take that in the reduction in the most recent reductions in deaths in this population, we take that into account, we still, if we were to compare sort of the pre-COVID death rates to what we are seeing now, those rates are still higher than what we saw then. So for the American Indian population, in 2019, it was 46.1 per 100,000, and 2024, 69.5. So it's still 50% higher, but obviously it's going in the right direction. So we hope that will continue. And so the other really nice thing, the thing I really appreciate about our state Office of Public Health, our state Office of Minority Health and Health Disparities, and Injury and Violence Prevention Branch. So they've been pretty purposeful about ensuring that we have to take a equitable approach to addressing some of these issues. And so if you look at the state opioid and substance use action plan, they do mention, you can see the graph that they include in that report and the ways in which they think about this equitable lens they use to address or they have been addressing the substance use issues in our state. And so, again, just very appreciative of their paying attention to these issues. And one of the things that we did back in 2019, we actually applied with Scott and Mary Beth. We applied for a small grant from the Council of State and Territorial Epidemiologists, CSTE. So we had a tribal summit, and it was held on June 24th in Raleigh, in our state capital. And what we wanted to try to do is to, first of all, let people know about some of these issues that we were facing, and to try to address an action plan. And so we invited representatives from all of our 8 tribes, from our urban Indian organizations, from our Commission on Indian Affairs, EHHS, and so a number of different entities, Wake Forest, who's hosting today. And so we wanted to make sure that we had broad representation, and we had I think about 60 people that ended up coming to that event, and we had a really good discussion with them. And so I won't read all of these, but basically, we came up with some really good suggestions on ways in which we can help understand some of these issues and address the challenges that we were seeing. Unfortunately, if you look at the date, obviously, holding this event, roughly less than a year before COVID, we definitely got sidetracked and weren't able to move forward with some of these. But there's been a lot of, as I'll share with you in just a minute, there have been a lot of wonderful initiatives that have been going on across the state that focus on our tribal communities. One of which is, so we have here in North Carolina, we have a state syringe service exchange program. This was in 2016. This is the law that went into effect in July of 2016, that any governmental or non-governmental organization that promotes scientifically proven ways of mitigating health risks associated with drug use or other high-risk behaviors can start a social syringe services program. And so that was a really great way of ensuring that our state was paying attention to this issue. And so we were able to have one of our tribes in North Carolina, the Eastern Band Cherokee, became the only one at the time, the only one of our tribes to become a syringe exchange program. And so this is the distribution of the in 2021. I need to update the slide of the counties in our state that are covered with the syringe services programs. And so you can see that as in the years since 2016, there's been a huge increase in the number of people that have been served through this program. And so what's called SOLI, the way that term is pronounced is SOLI, the SOLI Syringe Services Program. So they have been very intentional about making the service available in the community. So for those of you who don't know, Western North Carolina is mountainous, so the Smoky Mountains. And so it's an area where it's difficult to drive, particularly in the wintertime. It's difficult for people to get around. And so the Eastern Band Cherokee, who have their own public health program, they were able to put into place around their community. They were able to put locations where people could drop off used syringes. And so this is just one of the articles that they published in their local newspaper about the program. This is one of the boxes here on the right where it's what they call the syringe kiosk, where people could drop off their used syringes. And then it was actually noted as a CDC best practice, their program, and CDC featured them on their website. And so you can see that, I mentioned hepatitis C being a significant issue in for American Indians in North Carolina. And so you can see, what happened over the years from 2011 up to the spike in the diagnoses of hepatitis C in 2016 up to 116. And this is a population, the Eastern Band Cherokee is there's only about 12 to 14,000 Eastern Band Cherokee people. So this is a large number of people to be diagnosed with a condition like this in such a small population. So they've been able to get their numbers of diagnosed cases of hepatitis B down to the numbers where they were going back to 2011. So, and I'll share with you some of the other programs that are going on, and some of them amongst the Lumbee tribe. But I want to sort of bring to your attention some of the issues and some of the challenges that we face as we try to implement not just programming to address substance misuse, but really any type of health issue that's affecting our tribal communities. And the first of all is to think about some of the historical and contemporary trauma that is impacting our tribal communities, and thinking about, I mentioned forced removal as a historical trauma, thinking about the federal boarding school process, which occurred primarily in the 1900s. People don't realize that even up until the 1960s and 70s, the federal boarding school process was still in place. And so the picture on the right here is from the largest of the federal boarding schools in Carlisle, Pennsylvania, where Native children were taken from their reservation. Some were coming from New Mexico and Arizona, and coming to Pennsylvania. And so they were basically stripped of their culture, and they were forced to speak English and wear English clothes. And so those types of things caused trauma over the generations. We also know that Native women in particular are about 8 to 10 times more likely to be a victim of a violent crime, either domestic violence or like partner violence or stranger violence. And so there's been an acknowledgement of this issue. So MMIW stands for Missing and Murdered Indigenous Women. And so we just had an acknowledgement of MMIW Awareness Day on May the 5th. And so those are just sort of two examples of trauma that have impacted tribal communities and continue to impact our communities. And so this diagram here, so I know probably most of you are familiar with the social determinants of health, and there's actually a sort of a Native focused social determinants of health in that is focused on some of the issues that impact tribal communities. So looking at the root system of the tree and sort of what has fed that over the years, and how that sort of manifests itself in some of the chronic diseases and mental health issues, and also would apply that to substance misuse. And so this is a really nice model that I like to use when I'm talking about some of these issues. So another issue that's really kind of interesting is the issue of what we call racial misclassification. And basically what that means is that, a lot of times when we look at data for, data that I just showed you, for example, on different health outcomes for Native people, sometimes you have to take into consideration that there is some degree of in a medical record, in a death certificate, any place where a health outcome can be extracted, it is not uncommon for a Native person to be misidentified. If you're not reporting your own race, if someone just looks at you and says, "Oh, this person is this race," that is not an uncommon practice. And so we have to take into consideration that some of the data that we look at has to be considered with a caveat that, that it might underrepresent what is truly happening in this particular population. And these are just a couple of publications that where this is highlighted. One here in North Carolina, and one that's has more of a national focus. The other thing to take into consideration is that I mentioned that Native people, Native communities have their own traditions, their own history. And so thinking about some of the customs and practices that are reflected in that cultural heritage is very important. I was just down in my tribal community yesterday. I met with some of our tribal leaders there, and so they told us I was with a team of folks here from UNC, and so we talked about we have a big community event coming up in July. It's our Lumbee homecoming. We have a powwow in September every year. So powwow culture is very important to many Native people. Understanding those things and how they can be understood within the context of providing programming for a community is very important. And so, the young woman here on the left, she's dancing at a powwow, but she's also wearing traditional Lumbee clothing. The emblem on the front there is what we call pine cone patchwork, which is a very distinct. When you see a person wearing that, they're from our tribal community. So that's something that's very important. If you're in a situation where you're trying to develop programming in a tribal community, it's very important to understand what their traditional customs are, what their practices are. Are they powwow people? Are they people who do they do smudging? Do they use traditional medicine? All of those things are very important. And so this is just some examples of. So we know that for many Native people, tobacco is very important. It's a very important part of their culture. It is considered medicine for many Native people. I grew up in the southeastern part of North Carolina, so both my grandfathers were tobacco farmers, and so in our community there was an economic connection to tobacco, and some of the work that we do here in North Carolina. Dr. Rachel Denlinger led a team of researchers to look at tobacco use among American Indian people here. We actually just submitted a paper for publication, and we showed that among adults among American Indian adults in North Carolina, they have a rate of smoking around 26%, which is double the state average here. And so this is an issue that we have to deal with in trying to understand when you're doing tobacco cessation for Native people. You want to respect, obviously, their cultural connection to tobacco, but understanding that the use of commercial tobacco can have harmful effects on your health. And I mentioned some of the traditional healing practices that are important in Native communities. So it is not uncommon for a tribal community to have people who are recognized as traditional healers. And so people will go to them for to address some health condition that they have. And it's also important. So my brother, before he passed away last year, was a pediatrician, and he would always ask people, or he would ask the parents, that he would say, "Are you using a traditional healer if the child had a medical condition?" You run into situations where if you don't understand that, then it can cause complications, and so understanding not only if a native person is using a traditional healer, are they using remedies that have been passed down from generations? Are they using any um, cultural customs that are important to them? My brother talked about oftentimes a family would come in and they would do a smudging ceremony on him where they would burn sage or tobacco and then use some of what has been burned and would smudge that on his forehead and use the smoke to cover him. And so and that was a very important honoring ceremony for him as a provider. And then we're hearing more and more about what we call the native foodways, where native people obviously have a connection to the earth and to the gifts from the earth. And so we talk about native foodways as being um, ceremonial, but also having very important health benefits. Um, it's also important to understand that, when we think about native people, um, communication is very important. Native people, by and large, are um, uh, we refer to native people as being having oral traditions, so communicating orally about history and culture and customs. Uh, Obviously, some native people have their own native language, and so understanding how certain native words apply to what we understand in English is very important. I don't speak a language from my tribe. I know some people do from our tribe, but I don't personally. But I know I've been in many situations where people will introduce themselves in their native language and then speak in English. So understanding that context is important, but also understanding that there are certain ways in which people describe certain health issues, that they will do that in a way that is connected to their culture. Also understanding the concepts of um, life and death and spirituality, how those are um, reflected in a tribal custom is also important. But also the importance of music and dance as language. And this is this picture here on the right is what's called a drum circle. And so if you go to a powwow, you will have what's called a host drum. And so this group here, they have a name. They're a drumming group. I can't remember which one it is right now, but there's many drumming groups here in North Carolina, and so they will play songs, they will sing. It's very intense, I will tell you. I've been in places where you might be in a gymnasium or in a small room, and a drumming group starts playing, and you can feel it. It's just very, very intense. And this is just this image here. You'll see this often where these four colors are represented in a medicine wheel or in certain imagery. And so these four colors they have different meanings. And so I don't want to represent them as just one meaning versus another, but these are just some of the examples of the ways in which the four colors, black, red, yellow, and white, are used. And so when you see this imagery, if you see it on a medicine wheel, it does have, from a health perspective, it does have the perspective of addressing all aspects of holistically addressing all aspects of a person. And you will hear native people, my brother would talk about this a lot, Native people talking about living in balance. And so if there's one part of your life, the spiritual or the physical or the mental or emotional part of your life that's not that's impacted, then you're living out of balance. And so they will talk about the importance of living a balanced life and making sure that all of those elements are working well. I mentioned earlier this issue of indigenous data genocide, and so have been more efforts in recent years to try to what they call decolonize data. And so thinking about the ways in which we can make sure that Native people are appropriately represented in health outcomes data, but also how they can be prominently represented. And so these are just a couple of examples of um, the there was a conference in Tucson just in April of this past year on indigenous data sovereignty. And then there's a group in, I think they're in Seattle, the Seattle Indian Health Board. They actually have some resources on ways in which you can, what they call decolonize data, which is a really, really great resource. And the other thing, so Native people are also sort of taking initiative uh, to collect their own data and have sovereignty over that data. And so these are just a couple of examples here in North Carolina. I know there's also movements across the country. For those of you who are familiar with the community health needs assessments, where health departments and health systems at the county level will collect data that reflects sort of the health of their county. There are movements now where tribes can do their own tribal health assessment, and so these are a couple of examples here in North Carolina. The Eastern Band Cherokee, they've been doing their own tribal health assessment for a pretty long while. So every 5 years they do a report. And so the most recent one that was done was 2023. And then our tribe, the Lumbee tribe, got funding from UNC to do a tribal health assessment in 2024. And one of the interesting things that came up in that report was that so the question was asked, what are some of the important health issues that impact our community? And substance misuse came out on top. It was the most important health issue that I think they ended up collecting close to 900 surveys. That was the one issue that they identified as being the most significant. And also tribes are in this era of indigenous data sovereignty and sort of taking control of research and health issues and addressing some of the traumas that have been impacted by researchers coming into tribal communities. Many tribes now have their own institutional review board. So I serve on our tribe's IRB. I was inaugurated in 2022, and we meet once a month. We have 10 members of our IRB. We do ask that anybody that's doing research in our tribe also get IRB approval from their institution, from their own IRB, but then also come to us for tribal approval. And we're looking mostly for, is this the research that's being done? Is it being done in a culturally respectful manner? And is it being done in a way to where the information that's being collected will have benefit for our tribe and for our community? And so we have also, our tribe has been moving forward with trying to address this issue that I mentioned with the substance misuse in our tribe. So there has been efforts in the past to create medical assisted therapy for tribal members. There's been, as a part of that, doing talking circles and having people who are going through substance abuse treatment, trying to have these sort of healing talking circles. It is, people sometimes refer to as like a focus group, but it's not really. It's more of a culturally appropriate way of for Native people to sort of speak their truth in a gathering. And so um, this is something that the tribe has been doing quite a bit of lately. And they've also had, so we had a really interesting situation occur. We had a hurricane that came through our community, actually two, one in 2016 and one in 2018, that were just devastating. And so there's an international organization called Core Response, and this was Sean Penn, the actor Sean Penn was instrumental in getting Core implemented. And so he actually came to our tribal community right after, I think it's right after the second storm, and started helping organize relief efforts in our community. And so that was 2018, and then so they, they were continuing their work, and 2020 COVID hit, and so Core kind of shifted their focus to focus on distributing um, masks and hand sanitizer, and so and then as we moved into availability of vaccines, they were helping to coordinate some of the vaccines in our community. And then they shifted their focus over the last 3 or 4 years. They focused on addressing the opioid epidemic. And so they are doing lots of education around the use of, addressing the issue through education, but also doing some naloxone education, how to appropriately administer naloxone. So this is just a picture of one of the members of the Core Robinson team at a local church in our community, showing how to appropriately use naloxone when you have someone. And also they're doing distribution of naloxone in our community. And also our tribe is part of a unique program called INCREW. And for those of you who are familiar with the NIH Heal Initiative, which focuses on substance misuse and pain management, there was funding set aside by NIH to create this INCREW program, and INCREW stands for Native Collective Research Effort to Enhance Wellness. And basically the focus of INCREW, which is again part of NIH Heal, was to help tribes and tribal serving organizations to create infrastructure to develop research strategies to understand and address the substance misuse and pain management in their tribal communities. And so there's, I can't remember the most recent number, there's about 30 of these funded INCREW programs across the country. And so we're in the second year of our grant, and our program, so we have a community advisory committee, we have a research advisory committee. We are developing a dashboard and a storyboard to educate people about substance misuse and the data that's available in our community. We're developing a research protocol, a culturally appropriate research protocol that can be used by people who want to do research in our community. And then we're also doing a pilot of a national pain management initiative that's going to be culturally adapted to be used in our tribal community. So I wanted to sort of wrap things up and let you know about a couple of resources. One is I was the guest editor of the North Carolina Medical Journal issue in 2021 that was focused on American Indian health in North Carolina. So if you go to the ncmedicaljournal.com, which is hyperlinked here, you can see all those articles. And one of those articles is from Mary Beth Cox, who was at the time wrote about the issue of substance misuse in our in American Indians in North Carolina. And then there was also an initiative just prior to COVID called the Native Pathways to Health, and it was an initiative that was largely driven by the Maya Angelou Center at Wake Forest University School of Medicine, and this was kind of like a tribal health assessment of all the tribes across the state, but they also did a really powerful video. It's about a 30-minute video that's hyperlinked here, and it gives some perspective on how Native people view health. And so it'd be really, I think, if you're interested in this topic, I think you'd really enjoy that article. And I would also, this is a recent article that just came out called Collaborating with Native Nations to Conduct Research. And this was a group out of the RPI International. And so, so you could take a look at that. It's not very long. I think it's like 7 or 8 pages. So, but it is just came out in January, and it's a really nice resource if you have plans to work in tribal communities. So that is it. Here's some additional resources if you want to learn more about some of what I shared. And I think we have, about 20 minutes maybe for questions?